I wish this story was clickbait, but it's not. So how did Microsoft Excel save me from going blind? Just to set up the context for this story, about 4 years ago in 2017, I was working in a company where we had to use Microsoft Excel every single day. So one day, or on multiple days, on more than one occasion, I was just working on my work where I began to notice that when I was looking at the cells, the rows, the grid of Microsoft Excel, I started to see slight distortions, and this wasn't something that I could notice quite well, you know, on the day-to-day looking at different things, because in real life it's very rare that you're looking at straight lines concisely. So when I was working on Excel and I was looking at spreadsheets, the grid really made it clear that I was seeing some things distorted. At the time, I sat next to a colleague that we knew each other pretty well, and I just asked him, like, do you also see distorted lines here, or am I going crazy? And he just glanced over at my computer and he just told me, I think you're going crazy. Everything's fine. Like, what are you talking about? I shrugged it off. I thought it was strange, but, you know, kept going for a few days. It just didn't stop. Like, I would look at spreadsheets and I would see distortions. I would look at across the room like I didn't see anything wrong. I'd look at the spreadsheet, distorted lines. And so one day I was having lunch with a few of my co-workers and I mentioned that I was seeing things. I said, I keep seeing distorted lines. Have you ever heard of this? Do you know it? Do you think it's normal? Because, you know, sometimes you can see like floaters in your eye, different thingies floating in your vision, and that's completely normal. So I just wanted to know, is this something that just happens normally to people? And one of my coworkers just looked at me and she's like, oh no, you need to go to the emergency room, like that's very serious, because your retina, it can dislocate in your eye or something, and that's a medical emergency, you need to go to the ER. And that startled me. I got a bit scared with that new information, so I called the hospital and I scheduled an appointment to go and see an eye doctor. Luckily at the time I was working for this company that provided private health insurance, which I could use, so I just went to the private hospital because I knew that it was going to be quicker. So I think this was on a Friday and I had the appointment on Monday. So on Monday I go to the hospital, I go to the appointment. I had scheduled the appointment during lunchtime because I thought I'll just go there during lunch, I don't need to miss any work time. So I go to the hospital, I go to the room, to the appointment, and the doctor, she asks me what's wrong. I tell her I'm seeing distorted lines and she says, okay, let's see what's going on. So she starts doing the tests. She does that test where they have a little lens that they look through and they point light in your eye. And as she's doing that, she's pointing the lens in my eye and she stops and she whispers, what the heck is that? Which is exactly the most reassuring thing you can hear a doctor say when they're checking you. So obviously that makes me not very comfortable with the situation. She says that, she stops checking me, she runs out of the room, she stays out of the room for a while, she comes back, she's like, okay, come with me. She brings me to another room, she sits me down, asks another technician or someone to perform a different test with a different machine on me. She asked me to go back to the original room. So I go to the original room, I sit there alone, just waiting for the doctor to come, not exactly sure what's happening. She comes back. She says she has some suspicions what it might be. She's going to refer me to a different doctor that does a different kind of test, and that I need to come back in 3 hours and take that test. And I start to become a little scared, I think rightly so, but she keeps saying we need to do this to figure out if it's something serious or not, so I need to come back and take the test. So I return a couple hours later. They tell me that they need to dilate my pupils, which I had never done at the time, and now I hate it with a passion. Basically, they put drops in your eye, which my eyes don't like anyone, not even me, putting drops in them. The nurse has to put drops in my eye that burn and sting so bad. And then once you have your pupils dilated, you look so freaky. And you can't see anything, everything's blurry because there's so much light going into your eye. So after that traumatic experience, I go into the room with the new doctor to do the new test. They tell me this is a contrast test or a contrast exam. So basically they have to inject ink in my arm. Imagine the ink from a highlighter pen, a yellow highlighter pen. They inject that in your arm, and then the ink goes into your blood and then makes your veins glow. More or less. So in this case, the ink would go into my bloodstream all the way all over and in the veins inside my eye. So then they will use a machine with the brightest light I've ever had to look directly at, and my eyes were very sensitive because my pupils were dilated, so I had to be like forcing my eyes to be completely open, looking straight at the light for minutes on end. I was struggling so much, the doctor was losing his patience with me. And then they take like a picture with a flash of the inside of your eye, and then they will be able to see everything that's going on in the veins because they're glowing because of the ink.
If you're new here, I know we just met, but well, this is my eye. This is the photo that the doctor took of my right eye that day, and I didn't have any issues with my right eye, so this is what a normal eye is supposed to look. Now, this is my left eye. As you can probably tell, it looks a little bit different, especially around this area right here where the veins look really glowy. This is due to the contrast dye that they used. It's making some extra new veins in there look much brighter when compared to the normal veins above that area. A normal eye has veins inside, but some conditions cause neovascular activity and growth, which means that existing veins can overgrow and branch out, leaking blood in the process. Because this is abnormal activity, if not treated, they can cause scars or lesions inside your eye. The retina and the optic nerve at the back of your eye are what communicate what you see to your brain. Therefore, if you have opaque lesions in the area, they will block light coming from your vision field, and you will have a permanent dark spot there, which is the cause of central vision loss.
And he told me that in order to stop these new branches of veins and blood leaking from continuing, he would need to inject my eye with a needle, which I'm almost hyperventilating at the moment just thinking about it. A little bit of PTSD going on. Okay. In conclusion, if I didn't accept to be injected with this medicine, I could become blind, not because my eye couldn't see, but because I would have these lesions and these scars inside my eye, which basically would prevent me from seeing. Which is exactly the kind of thing you're prepared to hear when you just went for a check-in appointment at the doctor and you're 19 years old. Oh my god, okay. After that appointment, I was scared. I went to the front desk of the hospital, showed them the papers that the doctor had given me, and they said, okay, we can do this procedure here. She went to check what the price was and she wrote it on a piece of paper and she gave it to me, and I looked at it. I almost died right there. On that piece of paper, the cost of the injection was going to be 2,800 euros. If you work in Portugal, if you have a decent salary, that's almost 3 salaries. If you work minimum wage, that's like 6 months worth of salary. I was so scared. I had some savings, but to be told in the span of hours that there's something extremely wrong with you, you can go blind, you have to take an injection in your freaking eye, and it's going to cost you your entire savings. I wasn't doing very well that day. Fortunately, I had the private health insurance. We sent in the authorization for them to cover the injection. I went back to the office that day still. My manager at the time did his best to try and calm me down. He said it was fine, like just go and take care of your health, don't worry about that. I don't know if it was the next day or maybe a couple of days later. I went in to get the injection done. It was traumatic, beyond traumatic. So from here onwards, if you're kind of squirmish about eyes and like things going into eyes, please skip to this timestamp right here. They gave me anesthesia for my eye, which I didn't even know it's a thing. It was just drops that the nurse tried to put into my eye. It stung so bad, worse than the dilating drops. And then I just had to stay there with my eyes closed, waiting for it to take effect, for my eye to become numb. Then they called me into the operation room. They had me lay down, same as if you're going to have any other sort of operation. You have to be laid down, like they cover you all up. And then they put this, not a cloth, but something over my face, and then it had like a pocket. And then the worst part of all, you know that utensil that you see in horror movies that they use to force eyes open? Yeah, they put that on me. And oh my god, you can't make any movement when that thing's on, okay? I felt like at that moment, I just wanted to blink more than I've ever wanted to blink in my entire life. I was making so much effort, like my eye was trying so hard to close. I don't know how I didn't rip my eyelids with that thing. Like, honestly, my eyes just desperately trying to close. My heart was racing so bad because I just felt trapped. The doctor was rubbing my eye with a Q-tip with some iodine. Is that what you call it? And when I say she was rubbing my eye, I'm talking about a Q-tip in my eye, like in the white of my eye, to disinfect it, I guess. And then they pointed this light, like, you know, the lights they have in surgery rooms, like big round ones. So they pointed that straight at my face so that they could see what they were doing. But obviously, because one, I only had one eye out. Two, I didn't have my glasses and I'm blind as fuck. All I could see was white. She was telling me, look to the left, look down, look to the right. And I didn't know. Oh my god, this is so embarrassing. Like, I was so disoriented that I couldn't tell which way I was looking. I was trying to look down, but I didn't know which way was down. I don't even know if you can understand what I'm saying. Like, this is so embarrassing, but I couldn't, like, she just said, okay, that's fine. Just keep looking where you're looking. I'm going to do the procedure. Do you know when you go to the dentist and they put anesthesia on your gums? And so when they're trying to like take a tooth out or something, you don't feel pain because you have anesthesia, but you feel the pressure and you feel the movements. So that's the same thing. In my eye, I couldn't feel pain, but I felt the pressure of when the needle went in. And then inside my eye, I saw like all the liquid spill out, and it was the strangest thing. And don't get me wrong, I know this is sounding so traumatic and so horrifying, but the whole process was like less than 5 minutes. It was so quick. But when she was done, she took that horrible metal thing from opening my eye. I just closed my eyes and it was the best relief I've ever felt in my entire life. She was taking my pulse. She was like, do you feel okay? And I was like, oh my god, doctor, I just want to stay like this with my eyes closed forever. And she became so worried because she was like, do you feel okay? Is your heart racing? Like, are you okay? She thought I was going to faint, but I didn't faint. So she put cotton or like an eye patch in my eye, and then she asked me like, how are you going to go home? At that stage, my family was going through some stressful periods. I really didn't want to bother my parents with my problems. I didn't tell my mom or anyone. And so I went like that with an eye patch in the subway. I went home. And then I stayed home for 2 weeks. And in those 2 weeks, I looked horrible. During the injection, all it takes is for the needle to struck one little vein and it will bleed out. It's not a bad thing, it's just normal, it's just like blood. But if your eye bleeds, the blood gets stuck in your eye. So basically I bled a little when she did the injection, and then blood will just start to dissipate. So my eye was like a mix of red and yellow. For the strong ones that may want or may be able to withstand this vision, I may put a picture if I find it, and I'll give you a warning. If you don't want to see it, just skip 5 seconds ahead, okay? 1, 2, 3. I basically looked like the clown from the It movie. And then after the 2 weeks, I had an appointment with the doctor and she ran some more exams on me. She said that the injection had worked, my eye had stopped doing crazy things that could make me blind. So each month I went back and took exams to see if it had gone worse or better, but at the time she didn't know if this was a problem that would continue, so they didn't really give me a diagnosis. 1 year-ish went by where every month I went to the doctor and I took those exams. Things were stable, everything was fine, until early 2019. I was watching TV with my boyfriend. We were watching Impractical Jokers, I can remember, and I saw a dark spot. It was the same eye. I started to panic, and that week I was trying to get hold of the doctor. I was trying to get hold of the hospital. I was trying to get hold of everyone. And for like 3 or 4 days, I couldn't get hold of anyone. Until finally, I remembered that I had the original phone number of the first doctor. And I called her and I told her what's going on. And she said, you need to go tomorrow to the clinic. We have to go and do another injection. If you've just heard how traumatic and terrorizing the first experience was, to hear that you need to go in the next day and do it a second time was horrible. So by this time my mom already knew what had happened the first time. Obviously, when I told her like a month after, she freaked out. She said, don't you ever not tell me something like this. But at that point everything was alright, so nothing to worry about, right? She went with me, we did the injection again. I don't know if it was worse or I can't even remember. I think I blocked it from my mind. So it turns out they diagnosed me with, initially with something they would call multifocal choroiditis, and then later they've diagnosed it slightly differently as PIC. After that, we initiated proper treatment with proper medication that helps me properly make sure that my body doesn't make me go blind for no reason. So far, so good.
These conditions belong to a group of rare inflammatory diseases called uveitis. For many of these diseases, there still isn't an answer as to what causes the initial triggers. This group of diseases affect people from all ages, even children, and there is no known cure. I've linked in the description box a few organizations that you can donate to and help fund research and support for people living with these conditions.
And that's it. I don't know if this was what you had in mind when you clicked on this video today, but that's the story of how Microsoft Excel prevented me from going blind. If this is what you were expecting, I don't believe it. But if you'd like to hear more stories from me, then click on this playlist. I have more crazy story times. We'll have more in the future. I hope you have a nice day and thank you for watching. Bye bye.